So I have clinical medicine end postings on like Monday in 2 days. So that's why I'm focusing mainly on clinical medicine. So basically, my videos might be very rough or very vague. First of all, you need to understand that these videos are for me myself. Okay. No, I am being selfish, but I don't make notes. Okay. So at the end of the exams, I revise my own videos. So that's why I'm making this for myself. You want, you can watch, or you can choose any other video. These videos are not tailor made, and are the roughest and like easiest videos I'm making. I don't edit, nothing I do. I seriously don't have time for all this. Coming to general examination in respiratory system, pulse, obviously, any febrile illness, the temperature would rise. So for every 10-degree rise in temperature, like sorry, every 1 degree rise in temperature, that is 10 pulse rate increases. So that's why tachycardia is there. So this one point is enough, I think. So respiratory rate, bradypnea and tachypnea, you read in like general examination. BP, there is wide pulse pressure in hypercapnia. I'm not here to discuss logic here. So basically, this, but still for remembering purpose, little logic I will discuss. So in hypercapnia, what happens? There will be more CO2. CO2, it will cause it will also cause a metabolic acidosis, it seems. This acidosis, what happens? It increases H plus. So this H plus causes vasodilation. So that's why diastolic blood pressure decreases. Also, this CO2 increases sympathetic drive, it seems. So that's why there will be systolic blood pressure increase. So SBP minus DBP is pulse pressure. So the gap is DBP is decreasing and SBP is increasing. So that's why there is wide pulse pressure. Okay. So basically, low blood pressure is seen in hypoxia and acute respiratory distress. So in hypoxia and all this, what happens? The cells are not getting oxygen, so they shift to anaerobic metabolism. That is lactic acid release. So this lactic acid release causes H plus, increased acidic condition. Again, this H plus, what it is doing? Again, it is causing vasodilation. Nothing, no CO2 to increase sympathetic drive. So that's why only vasodilation. So that's why decreased blood pressure is happening. Structural hypotension not required. Regular venous pressure in cor pulmonale and tricuspid regurgitation. Cor pulmonale is right heart failure secondary to cor pulmonale is a heart disease, right heart failure secondary to the like end stage lung disease. Okay. See the detailed pathophysiology yourself, but pulmonary hypertension leads to blood accumulation in the right ventricle, so that's why it causes a dilation and goes backward. So that's why jugular venous pressure increases. Temperature, evening rise of temperatures, high spiking fever, any fever kind of condition, pus kind of conditions is high spike fever. Parallel icterus are not required. Edema is cor pulmonale, again due to right heart failure, backward it causes, and edema, ascites and all it causes.